Welcome to Basic Science Lesson once more. In our class today, we'll be looking at classification of drugs. Classification of drugs. In our previous class, we started the topic drug abuse, and we were able to define what a drug is. We define what drug abuse is. We also explain the meaning of drug misuse, and we also look at reasons why people abuse drugs. So in our class today, we'll continue from where we stopped, and we looked at classification of drugs. All drugs that affect the mind fall into the following groups. Drugs that affect the mind of individuals are grouped into 5. 1. Narcotics. 2. Sedatives. 3. Tranquilizers. 4. Stimulants. And 5. Hallucinogens. So we have 5 groups of drugs: narcotics, sedatives, tranquilizers, stimulants, and hallucinogens. We'll pick this group of drugs one after the other and look at it. The first one there is narcotics. Narcotics, group number 1. Narcotics are drugs that often blunt the senses. They make one's senses to be blunt. They also make people sleep and relieve pain. Narcotics are usually referred to as opium and its derivatives. So commonly, where you will hear people call narcotic is opium and some other things that are derived from opium. Opium. Medical use. What is opium used for medically? In medicine, opium is used primarily as a source of a drug morphine. Morphine is used to kill pain arising from accidents or disease. So opium is used as a source of a drug. There's a drug called morphine that is derived from opium. And the work of morphine is to kill pain. And this pain can arise from accident or disease. Side effect and abuse of opium. When inhaled in smoke, it causes a drowsy loss of sense. The addict first enjoys pleasant hallucinations, but later is rendered helpless for many hours. So when an individual abuses this drug in form of inhaling, the effect is that the individual will have a drowsy loss of its senses. And then at the beginning, the individual enjoys pleasant hallucination. Hallucination is falsehood, a false perception of something, and then it can render the individual helpless for many hours. Group number 2, sedatives. Sedatives are a group of drugs used to relax the central nervous system and induce sleep. These are drugs that are used to relax the central nervous system. The central nervous system comprises the brain and the spinal cord, and they can make one to sleep. Barbiturates are the largest subgroup of sedative. So barbiturate is a subgroup of sedative. Barbiturate. Medical use. What is barbiturate used for medically? They are used to induce sleep, relieve tension, treat ulcer, hypertension, etc. in medicine. Then barbiturate abuse. When someone abuses barbiturate, excess dosage taken over an extended period causes physical and psychological dependence. When an individual keeps taking these drugs over a long period of time, the individual becomes dependent on that drug. And when that individual wants to withdraw suddenly from that drug, the abuser may suffer from weakness, convulsion, confusion, and other effects. 3. Stimulants. Stimulants are a group of drugs that excite the central nervous system. These are a group of drugs that excite the brain and the spinal cord, e.g. caffeine, amphetamine, and cocaine are examples of stimulants. And you know that this caffeine, usually you see it in our coffee drink and some of our soft drinks. Let's pick amphetamine as an example of stimulant. Medical use. It is used to reduce fatigue, sleepiness, weight, relieve mild depression, etc. In medicine, stimulants, amphetamine is used to reduce fatigue, that's tiredness, sleepiness, overweight. In people that are overweight, it can be used to reduce weight and then to relieve mild depression. When amphetamine is abused, it may make individuals overactive, irritable, talkative, and suspicious. Tranquilizers. Tranquilizers, that's group number 4. Tranquilizers. Tranquilizers are drugs that change or modify an individual's emotional state or mood. These drugs change one's emotional mood or they modify one's state or emotional mood. Example is Valium and Libron. Valium and Libron. Valium and Libron, medical use. They fall under the minor tranquilizers. Valium and Libron are minor tranquilizers. And then minor tranquilizers such as Valium and Libron are used to reduce tension and help individuals suffering from sleeplessness to sleep. So they reduce tension, and then when somebody is having difficulty to sleep, Valium can be used to help such an individual to sleep. The last group, hallucinogens. The last group, hallucinogens. These are drugs capable of provoking changes of sensation, thinking, distorted perception, self-awareness, and emotions. This drug provoke or changes your sensation, your ability to sense stimulus in the environment, thinking, it affects your thinking, it distorts your perception. You will not perceive right, self-awareness, and emotion. Example is SLD. SLD. And SLD stands for lysergic acid diethylamide. Lysergic acid diethylamide. Lysergic acid diethylamide and marijuana are example of hallucinogens. SLD and marijuana are example of hallucinogens. Medical use. There is no medical use of SLD or for marijuana. Medically, marijuana and SLD are not used. So in our class today, we looked at the different groups of drugs. We said drugs that affect the mind are classified into 5 groups. We have the sedative, we have the narcotics, we have the tranquilizers, we have the stimulants, and the hallucinogens. These are the 5 groups of drugs that we have based on their effect on the mind. So when we meet next in our next class, we continue from where we stop. Have a nice day.